What's up, everybody? Welcome to the Ex Nihilo podcast. I'm Eddie, your host. Good to be back with you guys. Good to be seen by you. I can't see you, so obviously, but I've got an awesome guest with me, Dr. Cody Kriegel. Now, this is one of the few podcasts where I feel like when I start, I always got some sort of baseline information, like a little bit of knowledge on the subject. And, I can kind of bounce it off. So if we're talking about sports, I can go there. If we're talking about fitness, functional medicine, health, healthcare industry, something. This is like one of the areas where I'm totally in the dark along with you. And so I look forward to learning a lot with you. Dr. Cody Kriegel, he's a board-certified integrative biological dentist and the founder of Vios Dental. And he's worked with thousands of patients nationally and internationally to help them achieve their optimal health all over across the board. I'm really excited for this conversation. Cody, man, thanks for jumping on with us.
Man, it's my privilege and pleasure to be here, and following you has been just a treat of mine. And so I appreciate you having me on. Absolutely.
And you're also a person of faith, which is pretty dang cool, man, that you also are doing the work you're doing, but you're doing it through the lens of the gospel, and you're getting to have that influence as well.
Yeah, man. I think that, to be frank, that's how I got into doing, this type of dentistry. I had an experience with some dentistry and some things with my own mother. And not to jump into the heavy stuff, but to be frank, I used to really be really vain. I used to care a lot about what people thought of me, more so than I cared about what, maybe God thought of me. And I think at a certain point in my career, he kind of turned the tables and said, hey, here's the deal. It matters about me and our relationship, and I'm going to put you in a position where you're maybe not going to be liked by a lot of your colleagues. And here we are. And he brought me there and just blessed me along the way. And it's been an amazing ride so far.
Yeah, I hope to get into all of that stuff. Because, it's, again, I think there's so many, the colliding worlds of like integrative medicine, functional health, and what you're doing. I think there's so much synergy. So like the ex nihilo idea, like the ex nihilo is Latin from nothing, like God made man out of nothing, or ex nihilo. And there's this idea that like God had created originally mankind for human flourishing, the people of God in the place of God under the rule of God, this original beautiful design. But somewhere along the way, sin comes into the world, things sort of break, and relationship between God and man is broken. The relationship between humanity and itself is broken, and relationship between humankind and the world, like our environment, is broken along the way. And I think what you do for a living is a sort of you get to sort of see that play itself out in your particular profession. But like, let's start at the top. You're a biological dentist. I've never heard of that. I don't know if a lot of people have, but I know it's growing in popularity. How does that differ from being like a regular good old fashioned dentist that I get nervous seeing, every 6 months?
Yeah, you're definitely not alone in that feeling. Biological dentistry is, think of it like a blending or a marriage of really high-tech dentistry, a functional medicine, and then honestly just like I like to sprinkle in almost like biohacking into it. And that's where my passion and things lie, and regenerative medicine and things like that. And so biological dentistry allows us to kind of do all those things to help kind of look at the patient as a whole human being, not just as a set of teeth or a mouth. And I think that's really the key to where systemic health can reside is the mouth controls a lot of that, and it plays a big role. And I think dentistry as a collective is waking up to that quite a bit. And so I just like to be on the forefront of it.
Yeah, for sure. So you bring up the term biohacking. So there's a term I can latch on to, right? That's attachable for me. So it's like trial and error, trying to discover, hey, what's the best thing for my human longevity, performance, well-being? How do I, improve as an individual? How do I live as long as possible? How can I live optimally? Like, how do I live an optimal life? How does that relate to dentists? Shouldn't I just like brush my teeth and floss, and aren't I good?
Yeah, I think all those things are good. And it's not like we're trying to reverse some of those type of things. But I think, for example, just to pick one thing to kind of run with, the oral microbiome is huge. And whatever we do as a dentist is always at the mercy of the collection of bacteria, virus, fungus, all these things that are kind of lurking in the mouth. And I kind of always joke with my patients that the mouth is like a trash can. It's never sterile. It's always the pH or the acids are always kind of manipulating in there with our food and our drink. And again, like that's another good one. All of our food, drink, everything enters through this area, so it's kind of the entrance to the system. And so when we start looking at those type of things, it's starting to push beyond, oh, hey, we have a cavity here, we need to drill it and fill it and then get you out of here. It's, hey, how does this play a role in the rest of your health? And then how can we set the stage for you to be optimally healthy? And what can we do from that standpoint?
So so if you were to ask a regular dentist, let's say, I don't know, I'll say regular dentist, I feel like that's weird maybe to say, but like your traditional everyday dentist that like most of us think of a dentist is, wouldn't they agree with that statement? Like, hey, I'm just trying to like help people flourish and help them live optimally. Like, what would you say are like those key differences between the two in terms of their like actual approach towards the practice?
Sure. Yeah. I think, we're all trained, especially in the US, we're all trained very similar. And it's kind of like the entrance card, or it's kind of like, it's so much training that happens in a few years, in 4 years of postgraduate school, that I feel like once you get out of dental school, and including me, we're all ready to grab life by the horns and go for it. But I think that's the point in where the real learning starts. Like, you know enough not to like kill somebody, and now you have to go like learn, get into the real world. And I think what we kind of collectively as dentists, and I speaking from my own experience too, and being a dentist and trained that same way, is we get a little bit myopic. So we start looking at, how can I fix a tooth? Because somebody has to chew and bite with that tooth. Of course that has to happen. Of course we have, cosmetic dentists that are phenomenal, particularly in the United States, that are concerned with, hey, how does this affect the way that you look and feel about yourself? Of course, that's supremely important too. I think being interested in health and wellness my whole life, and playing college sports and being kind of into that realm, I started to realize that some of the things that I was learning, I didn't agree with, and I wasn't told both sides of the coin. And I started to kind of dig into some of that research myself. And so I never like to take things at face value. This is part of kind of who I am as a human being. I like to have all the cards on the table, study things, and then start to make my decisions. And a lot of times I turn to prayer too. And I think in a world where we're bombarded with information, a lot of times you just have to start looking inward and looking upward and try to make those decisions for yourself. But I started to read, for example, about certain types of dental materials. So let's say amalgam is one common one. That's we call it a silver filling material. That material, it's a misnomer a little bit that it's called silver. It's about 50 to 55% mercury. And I would soon found out that that's illegal to use in many countries.
Wow.
So they're just these things that I was told, don't listen to that. It's silly. And then I started to dig into it, and then I would find research, lots of it, on, hey, yeah, these things aren't really good for people's overall health. That mercury does leach into the human being, and that can shut down mitochondria and ATP production. And so I started to learn that, hey, materials are important for what's in somebody's mouth. And, metals in general, that's a whole topic we can dive into, but I personally feel they have no business in the mouth. So those are the things we start to look at, as far as comparatively to maybe a traditional dentist is, of course, I want things to work and function long term, but how can I use the material that's the most biocompatible for a patient? How can I support their healing and regeneration? And we can get into some of that stuff. That's where I really like to get kind of out in the wind on those.
Okay, so thinking about like trying to analogize this for those who are listening. So would it be like something close to, hey, like, you go to a regular doctor and they might say, you should take this pill because this pill will help you stop having heartburn. And it does technically stop the heartburn, but it creates another series of problems. So like if you take Prilosec and it's supposed to, help reduce stomach acid, but your problem is actually low stomach acid, maybe it causes all these other problems in the body. Like, so if you were to put, so if the dentist is worried about like, hey, your bite integrity, or, hey, we want you to be able to chew so you don't have pain, they technically can solve that problem with amalgam or some other metal in your mouth, or some other I guess what would we call like something that they do to your mouth. Like I told you, I don't know what I'm talking about. And and they technically solve that problem, but it might cause us a whole series of other issues that were unforeseen, that they weren't really studying or looking into. Am I on the track or close?
That's exactly it. Yeah, I mean
Okay.
that's a really good primer on it. And like for example, people come in with cavities a lot, right? I mean that's and to your point or to that example, I think what we start to tell people is okay, they need high dose fluoride.
Mm.
And dental decay or cavities are not a lack of fluoride. That's
Ooh.
not what it is, right? So you start to think in those types of concepts,
Oh,
and then you learn that fluoride is really, really harmful to human beings. I mean, there's just a big lawsuit that ended with a
wow.
federal court saying so, and we've known that for a long time. So I think exactly it. We kind of choose these little things like, hey, we use more fluoride, but it's kind of, I know it's an overly used thing nowadays. Like, what's the root of that? And if somebody's on Prilosec, I'm looking at that because that's a problem.
Hmm.
So that just to like kind of piggyback off of you. Usually it's you don't have enough stomach acid. You're hypochlorhydric, right? And so that will
Right.
make that problem. I will right away I'll identify as this is a problem as to why you're getting decay. Prilosec
Aha.
does relate to that, like the stomach acid, like that. So that's the things I start to look at. And that's why it gets to be that blending of functional medicine. Of course, I'm looking at somebody's mouth and their teeth, but how does what else is going on like below here affect this? And then how does this affect everything below here too, right?
Yes. Okay. Yeah. So, they would, go to a doctor, they tell you have high cholesterol, they put you on a statin drug. The statin technically keeps your cholesterol low, but it causes a series of other issues in your body, and maybe doesn't fully even work to begin with. But that was never really a symptom of a larger problem, and maybe never solved the problem to begin with. So you just brought up fluoride, and I've been told my whole life that the more fluoride is in the water, the better. And now you're saying it's not good for. Like, explain that. Why is fluoride not healthy for people? And where's this lawsuit coming from?
Yeah, yeah. So, classically, and I want to say this too. I said a lot of these things too. Like I
Hmm.
started off this way as well, and I think what God gave me a pretty open mind, and I think
Hmm.
that's allowed me to start to learn these other things and to speak to other human beings and learn from mentors of mine, and not be so myopic or closed-minded that we think we know it
Yeah.
all. And I will classically always say, the more that I study and learn, the more I realize we don't know squat. God made us. I think teeth are an
Yeah.
perfect example of a creator. And
Mm.
I tell my patients that a lot. I mean, the way that they're designed, and we can kind of dive into that like honey hole, but like it's a perfect example of a creator. And so I just think God has woven himself throughout my patient interactions and what we're doing on a daily basis. And people come into us sometimes as a last resort, and they have all kinds of other health issues, and we start to locate things in their mouth that can be driving some of those issues, like autoimmune diseases, like chronic inflammation, like uh, insulin resistance and type 2
Mm.
diabetes. Like their mouth plays huge roles in those things. And if we're not helping our patients from that standpoint, we're not helping them, you
Yeah.
know? Yeah. Yeah. So fluoride is a great one. I mean, for any of the listeners out there, this is a really
Mhm.
pointed topic. Where I was going is that, I told a lot of people that it's a tooth vitamin. Like that's how
Mhm.
we verbiage it. But like, that's not true at all. It's not a vitamin at all. And
Mm.
so one of the best resources on this specific topic is a website called Fluoride Action Network. They're phenomenal, and they'll show tons of studies for the people that want to get into my engineering patients want to see. I want to see the studies. I want to see the stuff,
Oh
and
yeah, they do.
I throw it
They do.
all at them. I love those patients. But that's a great one to prime a lot of the public, because what we've known for a long time, there's plenty of literature to show it definitely lowers IQ in children. So that's the big one, and
Wow.
that's kind of the main focus of the lawsuit. So neurological issues with it. It's also really hard on the thyroid. It's hard on your bones as well. Your
Ooh.
pineal gland, your all-seeing eye, that intuition
Mhm.
that gets calcified with fluoride. So there's a lot of things that it affects. And if you brush your teeth with fluoride toothpaste once, are you gonna die? No. But every single day, 2 or 3 times a day, and then getting it
Mhm.
from your water and all the other sources that we're getting, you're getting a long-term chronic exposure that's becoming a problem. Yeah. Yes, and fluoride
Wow.
in your water, particularly on that
Yeah.
website, they actually show that a lot of other countries don't fluoridate their water. And over the
Mm.
last so many decades, they've actually seen the drop in cavities that we've seen. So it's not from fluoride in the
Really?
water. It's from that we've gotten better at understanding some of these things and improving our hygiene habits and things like that. But it's definitely not from fluoride in the water.
So how did it originally start getting? How did we originally start putting fluoride in our water? Was it like how did that originally even? What was the impetus for that idea? Was it the fact that hey, this will make your teeth stronger, so to speak? I mean, it's just kind of like the verbiage I've heard. But why did they start doing that? Is that
Yeah.
the reason?
Yeah, yep. It started with a group in I think a gentleman in Colorado, if I remember right, and he was noticing that they had higher fluoride in the water, and he was noticing some of the changes with teeth, and if you get too much fluoride, you'll see what's called fluorosis, which is white spots on people's teeth, and they become kind of brittle. Um, when you dive into the rabbit hole of this stuff, just like I know you dove in on a lot of things too, coming from your career and then diving into health and maybe things that you
Yeah.
always thought, weren't always true, and I think some of these things have always been there. We're just waking up to them more so now. But one of the
Mhm.
things with the fluoride topic that the rabbit hole that I dove into and found out was it's what we put in the water is typically a couple of forms of fluoride, the big fancy long terms, but basically a lot of it is a runoff from fertilizer companies, from phosphate fertilizer companies, and
Oof.
it's actually illegal to dump in the ocean. So we needed a disposal mechanism. Yeah, it's wild. Like
No
it's wild.
way.
Yeah, just like the Flexner report, like you've heard of that topic. Like we used to not really be
Yeah.
so pharmaceutically driven, and then all of a sudden we were, and we're our ages. We don't know what happened in the 10s and 20s, but like this thing's actually
Yeah.
happened, and we just kind of forget or we don't know. Yeah, pretty
Wow.
wild.
It's pretty crazy. Yeah, when you start going down the rabbit hole on a lot of the things that, we've mostly just assumed, hey, this is common knowledge. Like and you've heard it, I've heard it said, like much of common knowledge is a reflection of social bias. Like over the course of time, we all start to kind of just collectively believe something because it was once believed. But, I don't know what it is, if it's the internet or what, but we're sort of like kind of peeling back the onion and realizing, hey, there's a lot of things we've been doing for a long time that maybe aren't the best way to go about things. And I don't know if that's just human nature in general. Maybe it's just like the trial and error of being alive as a human being. But I think, I mean, whatever it is, the prevalence of information, the open airways of information on the internet has like allowed people for people like you, like people that are experts and have practiced these things and go, hey, like, I know you've been doing this, but maybe we need to go in another direction. And fluoride's one of those topics because it's like you go to the dentist and go, hey, here's a fluoride toothpaste, here's a mouthwash that's has fluoride in it, and make sure you use it all the time. And that's just kind of what you're told because you'll have stronger teeth. And it's kind of like the doctor tells you drink, tons of milk so you can have strong bones from the calcium. And there's no other factors at play whatsoever when they tell you that, and you kind of going, oh man, this is actually affecting me in a number of other ways I wasn't expecting.
Total. And I think that's where it's very humbling to realize that simple, quick fixes aren't typically the best ways. And that's hard. And that's hard for me in my life. The simple, quick fix sometimes is to give, one of my 4 kids exactly what they want when they want it.
Yeah,
And
for
usually that's
sure.
not the best way. I've made that mistake multiple times. And so I think in that situation, when people have, cavities, for example, and dentists are trying to do the best they can. Like we all are. I really do believe in the goodness of people. But I think dentistry is one of those branches of healthcare that a lot of old dogs, old tricks. We've been doing these things for a long time. And although we've had advancements in some sectors of dentistry, there's other areas of dentistry that we haven't had as many advances in. And I think that's where my passion lies into, like, how can we advance this thing? Because it needs it. Like if you're getting cavities, it's not a lack of fluoride. So what's the microbiome look like? What's your gut look like? And again, it's humbling to realize there's so many factors in this, and it's our job to be a detective and try to solve that for patients. And it's not always easy either, for sure.
Yeah, I mean, since you went down that road just right there with that last sentence, I mean, let's talk about that a little bit. Like, how much more connected is the mouth to the rest of what's going on in the body? Because, I think we slowly peel back the onion, right? So we go, okay, like I'll talk about mental health and how actually the mental health might be connected to everything that's going on. And so, okay, maybe I'll try my diet and see that my diet's actually connected to my mental health and connected to how I perform. And we're sort of slowly peeling this back. But for whatever reason, I mean, we kind of stop at the dentist, or maybe we just don't think about it. And it's like, well, of course, that's not connected. Everything else is totally, of course,
Yeah.
holistic and connected. But what I put in my mouth isn't, and the oral bacteria isn't. If we know our gut bacteria is, part of what's happening with the rest of our body, what about our mouth bacteria? So how would you say, so to speak, the mouth is really fully connected to the rest of what's going on in the body?
For sure. Yeah, there's a few kind of avenues that I like to go down when people ask me kind of like, how is this actually connected? And the first one is a lot of people come into us, they know our approach, but a lot of people will come in with leaky gut. GUT, gut, right? You have these tight junctions that are supposed to be there. They're open from, it could be gluten, it could be conventional, it could be a lot of things that now have destroyed that lining. The immune system's in overdrive, right? Chronic overdrive. When people have gum disease, they basically have leaky gum, GUM. It's the same process happening in the mouth. You have this tight junction and roughly the same types of tissues too, the gum tissue to the lining of your stomach, the kind of the whole gut tube. So when that door is open, basically, then you get bacteria in the mouth, and we kind of talked about that a little bit, but it's extremely diverse microbiome in the mouth. Those things get into what I'll call the inside body, inside your system, and then they start to get places that they shouldn't and drive systemic diseases. Things like cardiovascular disease and hypertension, things like certain types of, colorectal cancers and things like that, colon cancers, certain types of insulin resistance and metabolic syndromes, preterm low birth weights. So there's that component there is one of them, right? What's oral is systemic is usually kind of what I'll say. A second way is something called a meridian chart. This goes to like Eastern medicine, Chinese medicine. It's based on acupuncture. It's the same concept, a very old form of medicine, again, that we kind of cast away, but is actually really beneficial and one of the very well proven. Like people kind of think like, oh yeah, acupuncture kind of whatever, but like there's actually full on research journals devoted to this stuff for decades.
Wow.
And all of those meridians are these energetic channels that run through the body, run through the mouth. And so certain teeth will lie on certain meridian systems that will then we can kind of look at and say, we can start making, at least drawing some conclusions. If somebody having some issues with certain areas of the mouth, is a tooth have a block in their mouth on that type of in that area of their body. So we start to kind of look at that as well and start to infer some things as well that way, which is a really interesting. When the first time I heard about a tooth meridian chart, and if any listeners can Google that, they'll find them. We give one to every single one of our patients. But the first time I heard that, I was like, that's wild. Again, I'm open-minded, but like I'm gonna have to look into this for sure. And I started to do it. I started to look at things on my patients and kind of cross-reference with what they're going through from a systemic health standpoint. And it was pretty fascinating, and it was accurate. And so I don't diagnose with something like that, but it's just those things I'm keeping an eye on, and I'm trying to work into like, hey, what's going on with this patient, and what can we do about it? How can we help them?
Well, it's kind of, I mean, again, there's something about going to the dentist that just freaks everybody out, and you know firsthand how this goes. Not everybody, but a lot of people. It's like there's nightmares, and there's all these kids shows about going to the dentist. Oh my gosh, it's gonna be terrible. But then when you say, hey, listen, there's it's possible that your gums are letting in things into your body that could lead to have autoimmune conditions or different types of cancer. I mean, that's pretty alarming. And so what was your mindset when you kind of discovered like, oh man, this is a real deal, and like what I'm doing, there's more to this than just making sure people have clean and straight teeth and they're feeling good. I mean, what was that like?
Yeah, it was like I keep using the word, but it's true. It's humbling. Like God is so good, and instead of my favorite, this is a total tangent. My favorite animal is a buffalo. many people know this, but they walk into storms, right? Whereas a cow walks like away from it, but inevitably they end up staying in the storm longer because it catches them and they kind of sit in it longer. And buffalo, when they sense a storm, they walk towards it. And so as soon as I was met with some of this resistance of like, not only what other colleagues were thinking, but also just like what was happening in my practice, I chose to pray about it and walk into it instead of run from it. And
That's good.
That paid dividends. I think for me as a human being, I think personally it paid dividends. I mean, you played in the NFL, it's hard. These are hard things you do on a daily basis. And I think you learn the most from making the hard, from the tough parts, right? I guess is what I'm getting at, from the tough things in life. And so I chose to walk into it. And to get back to kind of my story about how it kind of blew up on me, or how I kind of started to realize some things, is I basically called. I saw a documentary on root canals saying that, hey, there's this whole other side to root canals. They might not be what everyone thinks they are. This totally innate innocuous thing. It was intriguing to me. I'd followed some of these concepts already. So my wife just is like, it was my turn for a movie night. So I chose a documentary on root canals, and she was like, whatever, like, if that's what you want, like, it's your night. And so I'm like, perfect, this is great.
Oh my God.
I'm married to a Proverbs 31 woman. This is great. She's like, so
Yeah.
I did. We watched it, and she's like, you should call that dentist. I'm like, I'm not going to call this guy. Well, I didn't want to shy away from a challenge from my wife, though. So I did. And the guy ended up being the nicest human being, super devout Christian, and basically said, this is what this whole thing is. And if you want to dive into it, you should look into this organization, which I became a part of. And I started to understand and study it, started saving research on like okay, there's a whole side of this that we're never just kind of told about. The only thing I was missing was like real proof, right? We always want proof. Like even in the Bible, it's like we want faith. I want proof, right? Old Testament. Yeah. So I was that way. I was ignorant, but I'm like, I need to have proof. If I'm going to go for this on patients, like I need to see a little bit of an action. So I thought, again, I don't know why looking back, these were kind of silly mistakes, but I thought, I'm going to try this on my mom. Well, I'm very close with it.
Nice.
So she had a root canal, and she had these areas of her jawbone that are called cavitations. Basically, they're areas that don't heal well after you have your wisdom teeth removed.
Mm-hmm.
Okay, now that I've studied this, I've learned about what this is. Like, my mom definitely has some. So I flew her down to this gentleman that became a mentor, and I understood what these things were and how they related to her overall health. These things were treated, remediated in a specific way, which we can kind of talk about. And then 48 hours later, her heart palpitations and heart issues that she'd had for decades went away and have never come back. Wow. And those things that we treated were on her heart meridians. They're on the areas of that chart that kind of deal with her heart. So then I was like, okay, skin, like here on the back of your neck, stand up. This is wild. Like this is like true. So then I had to go to the drawing board, and that's where I decided I'm going to walk into this storm and kind of figure it out and keep praying about it. And then it just doors started opening about, hey, come learn about this, learn about this. This patient comes in and they are having these issues, and we can kind of pinpoint it and solve it. And then it just snowballed, and it became just a way of life.
Wow. Holy cow, man. I mean, like the stories about this, I mean, it's novel. It's novel to me. I think it's going to be novel to a lot of people. And I'm almost like, I'm sad that more people aren't doing the type of work you are and aren't as critically thinking, as critical thinking as you have been, and the people that helped you were. You have this phrase, I forget where I saw it, but biological dentistry is not a separate specialty in dentistry, but rather a philosophy that recognizes all systems of the body are divinely interconnected. That's not a sentence I think you'd see in a lot of like dentist brochures. Like, what does that mean to you, and how does that play in with what you're talking about here, like hair standing up on the back of your neck as you're discovering some of this stuff?
Yeah. I mean, I think we've done so Western medicine is amazing. And if I get in a car accident, like take me to the hospital, like hopefully soon. In our acute care, like we're so good at it, like compared to decades in the past.
No doubt.
Chronic disease, we are very poor at, I'll argue.
Hmm.
It's basically trying to find, medications to fit symptoms. And it's never digging into like an autoimmune is a great example. Like, why is your body attacking itself? We weren't designed
Right.
to do that.
Hmm.
God didn't do that. Like wisdom teeth are another one. Like God didn't design us with this like third set of teeth to be removed just for fun. Like that's a
Mm.
sick joke that I'm sure he wouldn't play. So like,
Yeah.
just like those are the type of things that go through my mind. So I guess what I'm getting at is Western medicine has separated our systems. We have a cardiologist, we have a pulmonologist, we have a rheumatologist, right?
Right.
And we've kind of unconsciously started to kind of see the same way. And dentistry is like, of course, I know why. Of course, I treat the mouth. That's my playground. That's where we work. That's where we. But God didn't make us to be just these little pieces that are separate from each other, like Tetris blocks. Like we're meant to be this entire unit. And that's what I really like about functional medicine is they're trying to delve into the entire systems, and like your body shouldn't be attacking itself. So it's trying to figure that out.
Yeah.
But we are divinely connected, and
I love that.
he did a good job. And we have to, it's a puzzle for us all to kind of continue to learn about. And again, like I said, we don't know a lot. I think we know a lot. We know a lot, but there's so much more that we don't know and understand. And I'm excited to be on the front end of that learning.
Come on. That's wonderful, man. I love that. We hear this all in the functional medicine space a lot. People are seeing the mind, body, spirit interconnected, how what you eat affects how you think, it affects your spiritual life, it affects everything. It bleeds into everything you do. But seeing dentistry come into this fold, which it always was in the fold, but like you mentioned, just it's just something we hadn't seen. This is special. I think this is a special. I think it's enlightening. I think most people are going to hear this and think, "Man, yeah, that makes intuitive sense that would be true." But let me ask about metals because I keep forgetting. I gotta ask. You touched on it earlier. We talked about fluoride. People do go into the dentist and they put stuff in their mouths a lot. I mean, we got all sorts of different stuff. These various metals. I know they used to put like literal crowns over people's mouth with like gold and silver, all this different stuff. Take me through like a few of the types of metals that are commonly put in people's mouths and like why they're, or maybe they're all the same reason, but like why are they not good to put in your mouth, and
Sure.
what are the alternatives?
Yeah. Yeah. So metals, I think a lot of people think as far as dentistry goes that metals are kind of a thing of the past, right? Like amalgam is an old filling, and although
Hmm.
it's still roughly like 40-50% of fillings in the United States are still amalgam.
Mm.
Amalgam, I mean, just as a cherry on top, it's actually been banned in the EU starting January 1 of 2025. So like there's
Yikes.
things happening there that people are understanding and the literature's there and we need to do better. But metal caps used to be used a lot. And I think one rule of thumb is no metals in dentistry are pure. It's always an
Mm.
alloy. So you have a mixture of metals, and when
Hmm.
you put a mixture of metals, whether it's a cap or whether it's a metal implant, which is I think last time I looked just the other day, like a $6 billion industry, dental metal implants. It's a big industry to get
Wow.
people to have a tooth back. But these things are never pure metal, and so when we put them into somebody's mouth, and again we talked about it, like it's a very harsh environment. It's always wet. First of all, there's always these acid-base changes. You have a microbiome that is always intact and like always flying all over the place. Metals don't hold up very well. So think of it like a park bench or a boat propeller. They will rust and they will corrode. And that particulate, you can swallow that. There's one way there. You swallow it, and then that will initiate a response in the GI system. Also, it'll get into the tissues, and that'll activate what we call your innate immune system. So your immune system will take up a metal particle and say, "Wait, hold on, this is not normal. Let's mount the response." You start to get some inflammation around said metal. So the corrosion is one problem. Another problem is called galvanism. So this goes back in textbooks for decades, but it's basically like a battery. You have a positive and a negative. You have two dissimilar metals. They're in a wet conductive solution, which would be your saliva, and you will get a battery. you'll get a electrical potential through some of those metals. That's wild to think about, especially when that's, within a few centimeters of your brain, which is obviously runs on potentials and things like
Jeez.
that in your neurological system, right? So just those things, once you start realizing those things and thinking of those things in a different lens, you start to then be like, oh yeah, like, okay, that does make sense. And then you find that there's all kinds of studies on these things.
So okay. So most people have probably already gotten some of these like fillings or crowns or any of that stuff. Like, what are they just totally screwed? Like, what are they? What could someone do if they're like, okay, this may be affecting me, but even if not, I might want to look into, is there a way to get things removed? Like, how would someone go about that? I'm sure you've gotten people that come in and go like, what do I do now?
Yeah. Yes. So I think when we kind of look at those patients and we kind of say, hey, like, it's one thing to recognize these things are bad, but then it's a horrible thing to say and you're doomed. Sorry. There's nothing you can do about it. Yeah. So removal of these things is what a lot of people would choose. And we always have like an informed consent around these things. Like if it's not where somebody's at in their health journey, or we feel like it's not really, a problem for them, they have other things on their plate, right? If somebody comes in and they are, I don't know, 150 pounds overweight and they're struggling with their food intake and things like that, like, and they have this one little metal filling, work on your diet and your exercise first, right? There's those type of things too. And I think that those things need to be said, like that's important.
Sure.
At the same time, typically we'll go through and we'll remove these things if that's what a patient chooses. So there's a safe way to do it, a safe way to remove metals and things like that from a patient. I'm trying to shut this off. That it will allow us to remove it safely without a big exposure to the patient. That's the biggest thing is you want to do it in a safe manner, and there's ways to go about doing that. And then there's always replacement options. So we've transitioned to this world of ceramics. Of course, they look nicer, they're white, those type of things, but
Right.
they work better, they function better, and of course they look nicer, but then they're not going to have a systemic health response for a patient, which is always good. That's what we're after.
So they're slightly better than getting a metal, is what you're saying. Like if we go the ceramic route.
Much better. Yeah. So you
Much
take
better.
those things out and replace them, yeah, with a non-metal option. Yep. Yep. For
Why
sure.
why
I think the
wouldn't
biggest thing.
like your oh go ahead.
Go ahead. No, you go ahead.
I was just gonna say, why wouldn't your traditional dentist like go that route from the beginning? What, is it cheaper to use the metal or?
Yeah, I mean, for some patients, the metals have been in there for a long time. It was a kind of they had it
Right.
done, 20, 30 years ago. That's one thing. Again, the people are still using these materials, and I think because it's cheap, subsidized by insurance companies, there's always those type of analogies where
Of
it's
course.
less technique sensitive, so it's easier for a dentist to place. So that's where we go with like the metal, the metal like filling materials. Metal implants, though, those are very commonly those are the most commonplace. Like I place ceramic implants. There's a niche that we all follow as far as ceramic implantology. So if I'm going to put an implant into somebody's bone, I'm going to use only ceramic, which is biocompatible, very neutral. Think of it like a coffee cup, very neutral. There's no metal particulates or anything like that.
Yeah.
No galvanism, none of that stuff. Yeah. So there's always a solution. It's just about identifying that solution and then, of course, meeting a patient's goals.
Yeah, I mean, I heard a story about a football player not too long ago, or I mean, I guess it was been a while now, but had a like a fractured fibula or tib fib, and they threw some sort of rod in his leg and said, "Hey, you're gonna have to have this for a long time." And he was getting sick and he didn't know what was going on. Left the rod in and kind of found that you got exposed to the idea that, hey, like, do you have any foreign objects in your body? And they eventually removed the rod and like all of his symptoms went away. Like he was losing weight like
Yeah.
crazy. So he had some sort of like autoimmune condition related to whatever the type of metal it was. And sounds like a similar thing could probably happen if you're getting implants, metal implants, into your face. I mean, essentially.
Yeah. No, it's exactly it. It's actually, this is a really, really interesting topic. So people can have a full-on allergy or intolerance to a metal, many metals. In fact, one of the first things I do when I sit down with a newer patient, if it's a female, I can look and see if they're wearing any jewelry. And then if it's a male, I'll usually ask them if they get any rashes with like a button on a pair of jeans or something like that. But metal intolerances are super common, super common. And full-blown allergies are out there as well. And when you're intolerant to one metal, you are most likely intolerant to others. Now, remember that metal in this instance is in the mouth, which is, again, a very harsh environment. At least when like a knee or a tib fib is healed, it's a sterile environment. But the mouth is never sterile, right? Yeah. And so there are ways to check if somebody's full-blown intolerant to a metal or something like that. There's blood tests to run. But in that actual example that you shared, I had dinner with a orthopedic surgeon. I don't quote me. He's out of Washington State, I believe. And this was like a few years ago. And he does a lot with ankles, feet, things like that. And for years, he was putting in, of course, a lot of times in some of these, they don't have a lot of options, like alternatives. Thankfully, in dentistry, anything that we're talking about, the fluoride, the metal, there's always alternatives that have proven themselves to be much better options.
That's great. That's great.
But in some of these things, they don't have as many options, so it's kind of tough. But he had been now started his career was removing these metal pins, plates, screws from people's feet and ankles, and people were having all kinds of neurological issues, autoimmune issues, and no one would ever think that it's this going on, and it's like this plate that's in my foot or my ankle.
Yeah.
And then they remove it, and these things go away, right? And it's not like, I think the catch here is people would think like, oh, that's a one-off, or that's, woo-woo or whatever. But when you get into it, the immune system releases cytokines. Remember the whole COVID business, the cytokine storms? Like it's a neurological response an immunological response. It's very straightforward when you kind of get into the nitty-gritty on some of this stuff, on why it's happening. And so that's a really interesting story. And I feel like that stuff happens a lot. And in dentistry too, for sure. I mean, this guy spoke at one of our meetings, this gentleman, this orthopedic surgeon, and he was showing that he could pick up basically currents running from metals in people's mouths to their feet plates. Right? Like, that's wild.
Grief. Okay.
Yeah. So like, I think that just things like that we just need to be paying attention to. And people need to know these things. And then once we know better, I really think a lot of people want to do better. It's just, how do I go about it?
Man, I'm in Washington State, so I'm outside of Seattle. And I literally have a plate in my ankle from a fracture from like 15 years ago. And I don't know, like, I've thought for years, like, do I just get this thing removed? You don't need it anymore. It's just there. And so I'm like, well, I wanted to, but I'm like, man, maybe I should get this guy's name from you so I can do it.
I'll get it to you. I'll definitely get it to you. He's a super cool guy. But I think that's what I learned too, is that a lot of times these plates, screws, things like that, they don't always need to be there long term. And so it's just like a second surgery to remove. So people are like, whatever. But right. I mean, yeah, you know what I mean? So, but then you kind of start to think, well, if this is in tissue and we have an immune system that might not be reacting to these things. And, I just had a patient that reached out. We get patients from all over the U.S. and I had a gal that reached out and she was basically like, you're my last ditch effort. Long story short, she worked for a functional medicine doctor, has become a dear friend of mine. She's from out of state. She's like, would you look at my case? So she had a bunch of plates and screws in her face from a car accident.
Wow.
And that's beyond me. But I know an oral surgeon, a good friend, that could do it. So I got her set up with him. She flew there, had it done, and her life changed in like less than 3 days.
No way.
Like all these health issues, she started to improve. And no one would have ever thought. She had a lot of plates and screws and things in her face, and they didn't need to be there anymore. Mm-hmm. And so that's life changing for somebody like that. And so nice. Just stuff like that. I think that we're on the cusp of like, hey, we need to be paying better attention and doing better if we can.
Jeez, yeah. I hope, man, if there's someone listening or knows somebody that has got a story like that, this is definitely an avenue they should definitely travel down. I got to ask you about wisdom teeth, because I still have my wisdom teeth. Now I'm just being selfish. And I'm like, why, you did mention it earlier, so I don't feel totally selfish, but why do we remove them so fast? It feels like right when you have them, they're like, okay, you got to get those out. Um, why remove your wisdom teeth? And maybe should you remove your wisdom teeth, I guess is the question.
Sure. Yeah, so this is like this other subset of section of dentistry that's really come on the scene, and there's some really good practitioners, particularly in the U.S., that are looking at things this way. But so the first thing is why are they being removed? Or like, why do we feel like they need to be removed? Because a lot of times in dentistry, they're prophylactically removed. They're kind of like, hey, this could cause a problem, so let's get rid of it. And I think I think a lot of times that's a horrible idea, because that's a driver of those cavitations. So those areas that can be not heal well in somebody's jawbone, my mom's story and a lot of our other patients' stories.
Mm.
And so if we want to prevent something like that, one of the biggest things is how do we stop removing wisdom teeth? So usually there's not enough room for them. And so we'll say, oh, those are not enough room, let's get them out of there. You know, it's hard to keep them clean. And those things are true. They are hard to keep clean. But I think the real question is why is there not enough room? And classically, like, you know, parents save up for their vacations and like their kids' braces. It's like these automatics in culture now. And so, and they, you know, everyone's teeth are coming in, you know, not aligned and crooked and narrow and things like that. And I'm a culprit of this. I had braces. I had headgear when I grew up. Like, I didn't go within 10 miles of my school with that thing on, but I got the job done. I wore it all the time. But that wasn't maybe the best idea, because basically we need to be developing people's jaws where they were meant to be. So when you start looking at skulls from centuries ago, you'll see no one has decay in certain populations, and they have all their teeth. And so we need to be growing fully for room to have them. And that starts when you're young. Eating the right foods. Breastfeeding is super important for jaw development and growth and things like that. And so if you haven't had yours taken out, they might not need to be taken out. So don't just assume it. Sometime when we hang out, I'll take a look and I'll make sure. But
I'm down. They literally, every time I go in, they're like, hey, it's time to get them taken out. It's time to get them taken out. Like, well, they're not bothering me or anything. Like, well, but you know, the root could be too close to something, or it's hard to clean, and if they get infected, it's really close to your brain, and you know, it's terrifying all the stuff they tell you, but they haven't said like there's a problem with them. So I just don't like, I'm always a little bit skeptical, like, well, why? And I'm like that with like a regular doctor, and I don't want to just distrust people for no reason, but I would like a compelling reason for them to take them out. And I don't want them to get infected or something, but I do wonder, like, why do you want me to get these out so bad? And I can't help but go, you know, is this just like the system you've been taught? Like, why, right?
For sure. Yeah, and I think that's where, and again, I was a product of that system too, but like, I think now my concern long term, you know, we're building a new clinic right now. I'm a big visionary type guy, and I think what my passion is when we look at it, it's really actually become mainstream with like the Casey and Callie means and like some of these statistics on chronic disease and what's happening with our culture. I just got back from speaking in Switzerland on this exact thing and how dentistry plays a role in this. Like, what we need to do our part in this, and for me, it gets into the passion of like, this is a problem in humanity, and what is my role in trying to combat that problem? How do I approach my family in that way too, and take care of them in that manner, my 4 kids, and how do I be an example for them? But then also, like, integration is a huge backbone of kind of my ideology and concept. So like, what other technologies are out there that I can help a patient with in this manner? For example, like hyperbaric. I'm a big fan of hyperbaric. And so we're going to be trying to bring that into our new clinic. And it's like, well, there's studies on hyperbaric in people's gum disease. There's studies on hyperbaric and, of course, in wound healing. So if I have to remove somebody's tooth, like, I want them to heal like they're 10 years old. They heal quick. How can I get them into that regenerative capacity? You know, so like integration of these other types of concepts is really where I like, that makes me tick. And again, just like you, like, I like this stuff. I love to, I have a clip bones in the sun. Like, I like to do these things for myself. But then I started thinking, well, how can I push this into what I do for a living and help my patients like get better that way too? And of course, you start to find there's all these relationships of the mouth, and what hyperbaric can do for a mouth, or laser therapies can do for a mouth. Like, it's it's a fascinating time to be alive in this stuff.
Oh man, this is so cool. We've come a long way from, the traveling wagons and the old timey days with tonics on a wagon, trying to give people
Your car
stuff that they,
benefits, that was a classic, right? Yeah, yeah.
yeah, the big tooth on the wagon, kind of thing. And we've come a long way. So, man, this is unbelievable. Okay, let's try to help some people like attend our time. Like, what are some,
Let's do it.
aside from finding a biological style dentist like yourself, and maybe that's part of it. Like, what are some things that people can begin to do to think and care differently about their teeth and about their mouth?
Sure. A few things. One way to find a dentist that's kind of thinking this way. Of course, you can ask if you're seeing a functional med or a naturopath or things like that. They might have somebody, but there's a directory on an acronym. So here it goes:
Okay.
IAOMT. That stands for
N
the
is in Nancy.
IAOMT.
MT. Okay.
MT. International Academy Oral Medicine and Toxicology. So their website has a directory of biological dentists. So it's a good place to start, and you can search it by state, zip code, all those things. You can even look at it as who's a fellow, who's been to a little bit of training, who's been to a lot of training. And then also they're full of resources for people to dive into a lot of these different topics. Really good stuff.
I'm going to throw the link
Do
of
it.
that
Yeah.
in the show notes, along with the Fluoride Action Network too, just for folks that want to explore a little bit.
Dive into those, yeah. And then I would say, a good place to start, I'm a fan of decentralized healthcare when possible. For example, like somebody can go get their lab work. I think that they should have the ability to like check their vitamin D level or things like that.
Sure.
I think that you shouldn't have to have somebody that has some letters behind the name that should dictate that. So there's a company called Bristle,
Okay.
like a toothbrush bristle. And they have an oral microbiome test that is phenomenal. And you don't need a dentist or anything. They'll drop ship it to your house. You run the test. It's really simple. You send it back, and they will map your entire oral microbiome. And it's a
Wow.
fabulous report. It'll be as complex or as simple as you want it to be. And then I'm a big fan of data. I track my sleep in like 3 ways. I track my sleep. I get too far into the weeds. My wife will tell you I have an obsessive compulsive disorder about some of the dumbest details. But data is amazing because it will if it allows you to drive decision making. And so data without that capacity or capability sometimes is useless data. For example, if I have 2 glasses of wine at night in my sleep tanks, well, I know that next time maybe I should stop at 1. Something like that.
Yeah.
Like those are important things. So this set of data will then come with a conclusion in a sense, or a next step, which it says what you should do. These products are probably going to serve you well, depending on what your mouth looks like, and how to go about that. Maybe 2 weeks of this product, and then start using this product for maintenance. So it starts to make decisions, or help you make decisions on what products would benefit for you, and like next steps, which is really cool because I think that's really positive for a patient. And if you take that to your dentist, and if they're an open-minded dentist, maybe they'll look at it and be like, oh yeah, this is really cool. I'd love to be able to do this for my patients. And that starts kind of that train of helping people.
That's super helpful. Yeah, I'm looking it up right now, Bristle. So I'll include that in the show notes too for everyone listening. Yeah, decentralized data on yourself, blood tests, hormone panels, man, I'm all for that stuff. And just to think that, hey, this sort of thing exists. And not only that, they're going to help you sort of figure out like what a good plan is for you going forward based on your specific mouth. Like, I'm all in. This is fantastic information.
For sure. Yeah, and I think too, one of the last things I'll say is consumer pressure does change things. Again, the calorie casein means and what we're finding about what's in our food here, which has always been there, but now it's like people have stepped up to the table and said, this isn't okay. Like, and what our kids are getting and things like that. And so consumer pressure, I think overall is a good thing. And being able to look online at things, I think many doctors would say, don't go Google something. And I kind of say, do it. Like, I want you to learn as much about a topic so you can make a decision that you feel is best for yourself. That's important for people. And so I think when we approach it from that standpoint, and you will start to change dentistry collectively, I think with consumer pressure in a positive manner. I think dentists, by and large, we do want to do better for people. No one wants to, well, most people don't want to come out and do a bad job on purpose, right? But everybody's human. You know, I have cases that are tough and that I wish I could change something and go back to the drawing board. And for me, I watch film, I watch video on how I do my procedures, and then I'll go back and change things and just weird things like that. But we will change it all together. And I think humanity will. It's just sometimes it's just hard to we just want it all to happen now.
It would be great if it did. Dr. Cody Kriegel, hey man, this was one of my favorite episodes I've ever done. And I mean, you probably do this all the time and it's just business as usual, but like, this is so fascinating. Like everything you're doing, I'm thankful that the Lord put you where he's put you. I'm thankful that he's changed your mind. I'm thankful you're seeing things in your profession the way you're seeing them, because you and the other guys that have influenced you, man, it's truly inspirational that you could look at your profession and say, hey, how does this work as it relates to the way I know I've been divinely created? So thank you for what you do. Where can people find out more about you? You have social media, website, all that stuff.
Yeah. So our website is viosdental.com. And we do take patients from all over the place. And we're more than happy to help anyone out there. And then Cody Kriegel DDS is my Instagram handle, and we're always kind of sharing stuff. And I like to be a little bit more lighthearted on that. And I have a family, 4 kids, and we're all living life together. That's a little bit more of a personal side to myself, but some clinical stuff too, some fun stuff.
For sure. I love that. Awesome, man. Well, thank you so much for being on. This was fun.
Awesome. Thank you for having me. It was super fun. We'll do it again.
We will. One more thing. The statements in this video or audio have not been evaluated by the FDA, the U.S. Food and Drug Administration. Information provided here is not intended to diagnose, treat, cure, or prevent any disease. The information provided by this website and or by this podcast is not a substitute for a physician visit and should not be taken as medical advice of any sort or kind. This is a list of resources for further self-research and work with your personal physician if needed. By using any of this information, by watching, listening, or reading it, you are accepting responsibility for your own health and health decisions, and expressly release this podcast, its participants, and its websites from any and all liability whatsoever, including that which might come from negligence. Also, don't smoke cigarettes, don't do drugs, stay in school, don't touch hot surfaces, and please wear your safety glasses when cutting wood.